Okay, hello, how are you? Good morning. Good morning, everyone. Good morning. This is Szenan from Center of Balance, the acupuncturist. Right. I'm the acupuncturist from Center of Balance. Okay, just kidding. Right. Today our topic is low back pain home remedies, which means what can you do for your back pain at home? So what you're gonna do for your back pain from home? So I'm a bit late today because we're gonna have expecting plumber to come in today, so I have to get the our shower tidy up for plumber be able to get in today. Plumber will be here soon. Okay. Good morning, Veronica. I'm good, thank you. Hi, Joe. How are you? Thank you. Hi, Happy Day. How are you? So good morning. Good morning. Hello, Happy Day. Now we're gonna start straight away. Okay, pretty much straight away. Okay, because I'm running late for today. Hi, Eric. How are you? Now, if you're on this live webinar, please say hello to me. Veronica and Joe and Eric always say hello to me. Thank you very much, and give me a thumbs up. Give a thumbs up, and if you like this video, please give me a thumbs up. Hi, Hassan. Nice to meet you. Thank you for joining us. Then tag. There's a tag on Facebook. Tag your friend and your family in here if they suffer from back pain, or your colleague who is an acupuncturist, because this information is important. Okay, we know we give patient treatment. We give patient treatment in our clinic, but what can they do at home? What can they do at home? This is so important. This is so important. Okay, so I always believe that if patients get better, this is not all because of how good the practitioner is. Okay, it's because how the patient can cooperate with the practitioner, and what does the patient do at home is important. Now, when patients get better, you fix the patient. It's not just because of you. It's because you, patient, and the universe, right? So the universe is helping the patient to heal, right? The universe is helping the patient to meet you to heal and get you to heal the patient, and not just you, not just you. So we thankful for everything that is actually involved in the treatment. Right? And you will find a patient do the home program, and you find that the patient result speed up faster, much faster, and the result actually remain like stable. It won't go up and down so much. It get better and better and better and better. Of course, if you treat patient, in a real case, in reality, the patient got better and worse, a little bit better, worse. It always go like better, worse a bit, better, better. It keep going, but it's going up and down a little bit, and then eventually it got better. Okay. Now it won't get this. We get treatment. Woo! So it's not like this. But always, if you get this better, worse, better, worse, better, worse, then that's not good. All right. If that is something happening, you need to set up a home program for your patient. All right. So I do agree with physiotherapy. Send patient home with exercise. Okay, and I do agree with that. Okay, now if you know any exercise that you can provide to your patient, hey, This is going to help. Happy Day say your teaching has helped me to improve in my practice. That's great. That's great. I'm happy to share everything that I know, and I'm glad that you said that my live video actually been improve your practice. That's great. I'm happy to hear that. Thank you very much. And so this live video may not for those experts. You know, they are very good already. Uh, this this is actually for people want to know about my experience. People want to know about a lot of other informations. You know, home remedy, because a lot of master wouldn't tell you that what do they send patient home to do. You know, and this is something that we do, and most practitioner, most doctor, and will focus on the technique. What I mean the technique is you advise your patient to come 2 times acupuncture, 3 times acupuncture, or daily acupuncture with Chinese herbs. Only focus on the treatment that you provide to patient, but less practitioner acupuncturists actually send patient home and say you should do this, you should do this, you should do this, and those will help you improve your conditions, you know, to get you better and better and better. And even less practitioner will suggest diet for patient, talk about diet and talk about emotional, you know. So these are important. All this combination are important to get your patient better and better and better and stay stable. Right? So if your patient, this is important. If you're on our Facebook page, then you know this is what we do. We always suggest you, hi Nina, we always suggest you look after yourself, not just when you come to us, it's by changing your lifestyle to get everything better. All right. So please share this video out with your friend and family if you're on Facebook, Instagram, and give me a thumbs up. That's important. Thank you very much, and let me know that you care about this video, that you care about this live video. Okay, you value it. Thank you very much, and that will help me a lot, and I'll keep doing this live video every day for half an hour. Now let's start talk about back pain, lower back pain home remedies. Okay, so the first thing most people probably thought about it, but some patients do miss out this. You know, I ask them, is it heat pack or ice therapy? So I ask patients, have you applied any heat or cold? Some patients say no, but most patients say, well, yes, I do. Then the next question is, do you find the heat helped or the cold help? Now, if they do heat or they do cold, they will let you know. Some will say, well, I'm not quite sure whether it helps or not, but I just do it. But I will tell you, most people will tell you, yes, it did help. You know, it helped me more comfortable. You know, it helped me relieve the pain, and that's good. Then the next question, you know, ask them, doesn't matter whether they say yes or no, whether the heat pack and cold pack help. You ask them, where do you put the heat pack? Where do you put the cold pack? And how long have you been doing it? And how long do you put it on? All this question is important because you want to check on how often they do that. Okay. Now heat pack, I would suggest for 10 minutes to half an hour. 10 minutes to half an hour. 10 minutes might not good enough to get rid of the pain, to relieve the pain, but half an hour may be good. Okay, so I don't know. You need to test it out. As patient, you need to test it out too. Okay, now the next thing is eyes. How long for ice pack? Well, ice pack normally you do it for the first 2 days, 24 hours or 36 hours or 48 hours, 36, no, 48, something like that. Right? It's new injury, acute phase. There's inflammation like uh, swelling and as well as hot sensation. Then you do that. Okay. Now, so do not apply the ice directly on the skin. Normally, you wrap it into a thin towel, okay, and then put it on the skin. Okay, so this is to prevent the skin damage. Okay, so how long can you do that? 你好, once more. Okay, we speak in Chinese today. I'm sorry. At night time, we're gonna do in Chinese. In Chinese, but in English at the moment. I'm sorry about that. If you are okay with English, keep joining us. Thank you very much. Okay, now for the eyes, you don't heat. Heat you can normally do longer. Right, eyes. Well, I would suggest about 5 minutes. Take it off and feel how it feels. How's everything going? And then give it a few minutes off and then put on again. On and off, something like that. 你好，你好，你是晚上，我们这边是早上。感谢你上来。Okay. Okay. Now, so I normally suggest my patient, no matter what pain it is, I suggest my patient put heat pack on the belly button. I say, well, keep the heat pack on your back. If it's 10 minutes will help you or half an hour will help you, do that. As well as if you have 2 heat pack, get another heat pack on your belly button. Okay, or get another heat pack. If you just have 1 heat pack, you have to do another one for your belly button. So this is important. Why for belly button? Because apart from your lung and your heart, all organs are in the tummy. So you want to keep one in the belly button to help the circulation in the tummy for all organs. The reason is once you increase the circulation, in the tummy, you increase the circulation on all the organs. Then that help the organ function better. So remember, this is important. So therefore, in my clinic, we give patient heat pack. I don't use heat lamp. Because I tried myself. Heat lamp difficult to control. Heat pack much easy, and heat pack is much comfortable for my patient. And I try myself with heat pack and heat lamp. I feel more comfortable with heat pack rather than heat lamp. Okay, I know majority of acupuncturists are using heat lamp, right? But I don't use that. I'm sorry. I use heat pack. I feel heat pack. We in our clinic we only do heat pack. Okay. Thank you for joining us. There are more and more people joining us this morning. That's great. Thank you. Okay. Now let's keep going. Any question? What do you suggest? What do you suggest your patient to do with heat pack or cold pack? As I said, heat and cold. I always ask patient that listen to your body, not just listen to me, because most of the time we suggest heat, right? When we suggest heat, and the patient may get worse. What happens when the patient get worse? Be smart. Do the opposite. Use cold. Try out cold. For those patients that say they're not quite sure whether the heat is helping or not, I say, well, have you ever tried ice pack? He said, no. I said, give it a go and let me know, figure it out whether it helps or not. If the heat help a little bit, keep going. Keep going. Even though it's chronic pain, even though it's chronic pain, even though it's acute pain, but it's been a long time. As I said, two cases uh, in my practice that they use cold packs because heat packs make it worse. So I suggested to use cold packs. And one of them actually she's been using um, cold ice pack, and she came here and said, "Well, try to use heat pack." And then she did listen to me, and it got worse. And then she was smart. She changed back to ice pack, and she came back to me and said, "No, I can't do heat. Heat got me worse." It was for her lower back, and the pain going down to the legs. And as soon as you put cold in it, pain disappear, and no longer any pain down to the legs. And every time it happened again, you put uh, ice pack in it. So listen to the body rather than me, rather than your practitioner. Doesn't make sense. So you tell your patient to be smart. If you're a practitioner, you need to tell them. You need to let them know. Because you don't know, you never get it right. You know, most of the time we got it right, but there's always one or two patients that we didn't get right. So if you're a patient that you've seen this video, every time when I get you to do heat pack and cold pack, and if you ask me about this, then I always say, well, listen. In the end, you have to listen to your body, not just me. Does it make sense? Okay. Exercise. What sort of exercise that can help the back pain? Right. I recommend Mackenzie back pain exercise. All right, Mackenzie back pain exercise. Well, with this, I can't show you, but I will film a video. I'll film a video to show you how to do Mackenzie back pain exercise. And I do agree with Mackenzie back pain exercise, but I want to tell you, not everyone benefit from Mackenzie back pain exercise. Okay. Hi, Lynn. How are you? Nice to meet you. Definitely not everyone benefit from Mackenzie back pain exercise. Okay, you need to be aware of this. Let me see below. Oh, okay. Kojima, nice to meet you. Thank you for saying hello to me. Please give me a thumbs up as well on YouTube. Thank you very much. Now, the posture. Okay, if you sit, you need to sit right up. You need to make sure here you have the curve over here. Okay, so which means if you sit in there, you're gonna bend backward a little bit and then go forward a little bit. Okay, bend backward to the extreme and go backward a little bit. That's how you maintain your posture. And not just that, you don't do this. Okay, so your what this shoulder need to go back and go there, and your neck. You don't want to get your back fixed and get your neck problem. You don't do this. Okay, tuck it. Go there. Okay, and this table is not good for me at the moment. It's too high. I went and get a new chair and I couldn't get it at the moment. There's no suitable chair for me because our table is big. If you sit down, so 90 degree, so your keyboard, if you work, your keyboard should be in here. You don't do your keyboard shouldn't be that high. And do this. Your keyboard shouldn't be that low and do this. About 90 degree. About 90 degree, okay? This is the keyboard height. And the screen. I actually you guys didn't see it. I actually have some little box or books. I actually put this, okay? Put it under my computer. So my laptop, I put it on top. So I put the laptop on top, the few one, and the screen actually goes straight. I'm watching you at the moment, this is my height. As you can see that I just watched there. I don't do this. I don't do this. This is not good for neck. Okay, this is not good for neck. All right. So make sure this is your screen need to be straight away like on the same level. Okay, you don't do this. If you do this, you're gonna get neck problem. Okay, so this is important. Okay, this is very very important. The posture. So exercise will show you next time. So why I do this because we bought um, the little things support for um, laptop, but none of them suitable for us. You know, fancy, they're fancy, look nice, but hey, none of them you're gonna get the same height that we need. You know, there is always lower. We still have to do this, and that's not good. But for all the company, they try to get good thing for the for for, for the employee. And my patient, they use it in the company. I say, "Wow, this is not good. Use this. It doesn't look nice, but it get to the height that you need. If it's not enough height, you just eat more and more and more and put it up, you know, and get the height that you need because everyone's different, you know. You're tall, you're short, you know. So I walked into my because we used to have one, right? And my manager, we used to bought a few of them, um, you know, and we figured out it's not good to use it. And my manager actually used one of them, and she complaining about neck pain. As I went into her office, I said, "Wow, why are you still using this?" I said, "You should use this." And she put two of them and that, and she's now sitting there and a good, very good things. I say because we as a practitioner we walk around a lot and we came in and type in and we go out and treat patients. And she's sitting there most of the time in front of a computer and work for a clinic. So and she came in to me and said, "Well, can you give her acupuncture?" I said, "Yes, I can do it." And I went in and checked in the office. I said, "No, no, no, you should do this because posture is very important. If you don't prevent it, no matter how good your treatment is, it's always going to come in again and again." Hey, I'll tell you, acupuncture get immediate relief with balance method acupuncture, with G acupuncture, with any acupuncture that you get immediate relief the pain. Simple, easy, very simple, right? Everyone can do that. Most of the acupuncturists can do that, right? Massage therapy can do that. Chiropractor, osteopath, physiotherapy, they can help with that. But think about it. If you are the person who's sitting in front of the computer, if you always do this, you know, you always go back there and do this, will you get better? No. While you see your practitioner, you get better. While your patient is seeing you, they get better. Once it stops, can come back quickly. Or you find it got better, but it keep coming back. What is nagging it? What is holding it back? You need to find out the trigger, the reason. So posture is most of the problem, maybe the main reason of it. So you need to teach your patient how to sit properly. Normally it's low back pain or upper back pain, whatever it is. Okay. Now I'm going to film another video for you to talk about how to get out of the bed. You know, I have patient, okay, um, back pain, back pain, uh, long term, and acute pain. You will, you have this patient too. You have this patient too. They have back pain in the morning, worse, or they have pain in the morning that is stiffness in the lower back for years. And when they come to you, they may come to you because of neck pain, not back pain, because back pain is not worse yet. They come to you because of shoulder pain, or they come to you with the acute back pain. It got worse now. And you ask them, they have back pain for a long time. And every morning, when they get up in the morning, painful. When they get up in the morning, it's painful. You ask them, why is it painful? What movement? And they most of the time they say, well, when I get up, get out of bed, it's painful. And they keep doing it, they keep doing it, they keep aggravated. So what is the best? How do you find out? You see, go to the bed right now, massage table, lay down and get up. And then do the movement and you watch over. You watch them how they do that. When they do that, you ask them, do you have pain right now? He said, yes, yes, I have pain. Look, oh, it's painful right now. Okay, now you know. You ask them, this is how you need to get in and out of bed. You sit there, this is the bed, you sit there, and then go sideways, sit down. You see what I mean? So they just sit there, sit down, this the bed, sit down, and go sideways using hand. Keep the spine straight, keep the spine straight, okay? Keep the curve. So do not, when you lay down, do not do this. You're gonna lose this curve. You know what I mean? So you're gonna go back a little bit and use your hand and go down like this. When you lay down on your side and your legs come out, I'm gonna film my video for you in my clinic, okay? Then lay down on your side and then turn over to the back. This is how you do that. Okay, so that can prevent back pain. Then when you get up, you're on your back, right? Go completely on your side. So go completely on the side. Then bend your knee. Put your legs side of the bed. Then use your hand to push yourself up. Make sure that you keep your lower back straight as much as you can. So you using the strength of your hand to push yourself up. You're not using the strength of your back muscle or core muscle. A lot of people have weak core muscle, and you need to train it up for that. Does that make sense? Have you ever advised your patient to do that? I'll tell you, a lot of people miss out this. Completely miss out. And this simple in and out debate, it helps a lot of patients get better from back pain. Now, tell me, have you ever get your patient to do that? Have you realized in your clinic that your patient every good from lower back pain is actually from getting out of bed? They don't feel back pain during the day. They don't get it. They don't feel it. Just in the morning. If they tell you just in the morning getting in and out of the bed, this is it. 100%. This is it. And I asked them to do this. They forgot. They will forgot. But you tell them, whenever you get out of the bed, you feel pain, that's wrong. Give you a sign, stop. And you need to practice this. When you practice this, I'll tell you, you won't get back pain and your back will heal. And they did it. They really heal. And they come back and we examine and say, I said, well, how's your back right now? He said, they're good. No longer painful in the morning. That's it. A very simple practice getting in and out of the bed. Does it make sense to you? If it makes sense to you, please reply, yes, it makes sense to me. Yes, it makes sense to me. Right? Can you please reply me if it makes sense to you, please? Hi, Teal, how are you? Please let me know, yes, it makes sense to me. So I need your engage. Hi, Nina, how are you? Okay. So this is important. Let me know that whether you get it or not. Right. Let's keep going. So I'm gonna film the exercise, back pain exercise for you. I don't know when I can film it, but I'm very busy. And essential oil. So you can put essential oil on the back. It's a good thing to get. What essential oil can you use? Eucalyptus. Okay. Eucalyptus is a good way to decrease the pain. Tea tree as well. Eucalyptus is we use a lot. That's very good for pain. Okay. What else? You can do a hot bath. Apart from heat pack, you can hot bath. And people put salt in it. Salt. Put salt. Epsom salt. Epsom salt. Epsom salt is very good for pain. So a lot of people use it. I don't use it. Okay, I don't suggest my patient do it, but most of the time, patient told me that they use Epsom salt that actually help. So that's good. Keep going. Epsom salt. Very good for muscle, ease the muscle achy. A lot sport person they after workout, they actually use Epsom salt bath. This is a good way to do that too, right? But it's much easier to get heat pack, simply heat pack on that, because you want to do bath. There is a lot of things to do, right? A lot of water and a lot of effort to do bath. But yes, if you can do it every day, go for it. If you can do it 2 or 3 times a day, go for it. If you find it benefit you, go for it. Nothing wrong with that. Try it and you feel better. And hot pool, if you go to hot pool, then go for it because it'll help your back pain as well. Okay, so that's about it. Okay, this is what the home remedy that you can do. Apart from that, I'm going to show you acupressure point. This is what I show my patient. Okay, now if the pain is on the bladder meridian, so if you're not a practitioner, the pain on the side. Okay, I normally get my patient to check the lung meridian. Okay, lung meridian, which is, if you're not a practitioner, so this is something that I'll get patient to do. So bend the elbow a little bit. Then there's a thumb side and little finger side, right? And you can feel that there's tendon over here. So on the thumb side, next to the tendon on the thumb side. So you get the ulcer point, the sensitive point. If you get the sensitive point, give it about 30 seconds to 1 minute, or even just 9 seconds, and move down toward to your wrist. So each point, just so move it one by one. You don't move from here, jump to here, jump to here, jump to here. Not like this. Okay, just one, a little bit, one finger at a time, one point at a time, and move. And find the ulcer point, find the most sensitive point. If you get the most sensitive point, give a wrapping massage, and it would help the pain on the side of the back. Okay, so I'm not saying which area is which level. As long as you figure it out all here, all in here. Okay, it'll help all back pain in here. Now the other is when we, as an acupuncturist, we do this, right? We do 5 back point in here. This is good for acupressure point as well. So you get it from here. So start from here first. First metacarpal bone and second metacarpal bone, and the joint over here. So and then move across to here between 2 metacarpal bone and move. Okay, 5 points that you can teach your patient of your patient. Just massage over here, sensitive point. You find a sensitive point and give it massage for about 1 minute or 30 seconds or 9 seconds, and that's fine too. Okay, so move across and move, do it for a few sets, and while you do that, move your lower back. Move your lower back. Okay, it'll help. Now, if it's sciatic pain, it went down. Okay, I would suggest you do it from here to here. Yeah, from here, start from here to here. Get the ulcer point, get the sensitive point from here to here. 1, 2, 3. So this is for lower back. If any pain down to your leg, from here to here. Right. So give it wrapping, and it would help. It would definitely help. Okay. Now I have patient. I show them, friend in Auckland. I went up and I showed them for acupressure point, and I worked for them, and it works. It works immediately. And I say, well, keep going, get rid of the pain. But people don't have the idea. And next time I show them in a month, I say, how's your knee? For knee pain. They say, well, it's still there. I say, have you been trying this? They say, no. And I said, well, you have to do that because it works for you. And then, no, it's not. No. and then encourage him to do that, and he do it again, and then as another month said, how's your knee? Still the same. Have you been doing the point? Yes, but it's still painful. When I do that, it's still painful. I said, wow, yes, let me try it. I said, well, those points that in 2 months, the acupressure point still very sensitive. What does it mean? This patient hasn't been doing it. Hasn't been doing it. You know it. As a practitioner, I know it because I tried myself. If the person who's doing it every day, within 2 weeks, this sensitive point, it may be still there, but it will get much less. It will get much less. So if a patient comes to you, they say, yes, I've been doing it, it doesn't work, ask them, show me how you do that. And you can correct them whether they're doing it not properly. Just let them know, because you're there helping them. So I know some people, I don't know why they are not doing it. They're not seeing any practitioner and they keep complaining they have pain. And when you show them and you do it for them and it works, but they go home, they don't do it. And they say, yes, I do it, but they don't do it. It's simple. It's simple. Then that is not my responsibility anymore, because you can't help people if they don't want to help themselves. Doesn't make sense. You only be able to help them if they want to help themselves. Just like you can't give any treatment to a patient if they don't want to come to you, because they don't want to get better. But they keep complaining about it. They keep complaining about the pain. So in Chinese medicine and acupuncture, we don't force patients get treatment. We don't. They in the old time they said you don't ask patients to come for treatment. Now you don't do that. You don't do that. You let them know what solution, how you can help. If they want to come for treatment, they come. If they don't want to, don't ask anybody. So, okay. This is the acupressure point. So this and here, something like that, and that should work well for lower back pain. Right? Any question at all? Makazaka? Santa, nice one. Yes, Santa is pretty good. Lower back pain. Yeah. Yes, it makes sense. Yes, it makes sense. Thank you for replying me, Veronica and Eric. Yes, it does make sense, right? So use it. I hope you use it, and I hope those helpful. The reason I do this step by step one, because if we do small topic, I can give you some information that I consider is valuable, because not many people will tell you this things little one, because we talk about back pain, the big area, and we always focus on just how acupuncture point strategy. And if we really want to talk about back pain, one other thing is the if they have diarrhea or constipation, bloating, you want to build up the core muscle, is the diet that have to change. The diet, especially the diet. I have a lot of patients that benefit from diet as plant-based diet, and it helped the back pain a lot. Someone sent me a bit long, but a nice explanation is why cupping works Western perspective used in the sport work. Oh, thank you. That's good. Szenan just sent me some information about cupping. Right. So yeah. So changing diet is another one. We don't talk so much in back pain, but hey, diet is very important. When we come to diet, why is it important? Let me share with you. The last thing is diet. Emotional as well. Emotional stress. Meditation. If you find help, meditation, home remedy is always help. If the patient's too stressed, too much work, they have to slow down. Okay, find a way that can de-stress them. That's another one, home remedy. Okay, and I use Ho'oponopono method, and whatever you can do, yoga, meditation, listen to music, watch a movie, de- de-stress them. Then this is important too for back pain. But most people don't think about that. But stress is the main thing for any pain. Then diet. Why plant-based diet? Because our body can't go without blood to heal, right? And what is in the blood to heal? Oxygen and nutrients, nutritional. So where do you get your nutrient from? The nutrient you get it from the food, whatever you eat, right? Doesn't make sense. Then to get the nutrient, you need to get a good quality of food. The quality of the food give you good quality of nutrient, right? Then you have to make sure that your stomach and spleen function good. Otherwise, and large intestine, small intestine, so otherwise they can't absorb the nutrient that you need. If they can't absorb it, they can't make it to blood, and the blood flow go there. We talk about what we try to increase the blood flow. Blood flow go there and you get better. But yes, you do increase the blood flow, but there is nothing much in the blood flow that can heal. There's not enough oxygen. There's not enough nutrition in the blood flow. The quality is not good. So why diet is so important for back pain to heal? You know. So what happened is we can treat them with acupuncture, and you find it helped. It got benefit from it. But what happened is they may not get healed properly. Always have some pain, or it comes and go, comes and go. And therefore, you need to think about to get rid of the back pain completely. That's something that probably patient can do even further, which is home remedies on in the diet. Home-based diet is what I suggest. The China study is a good book to go with, and I do encourage you guys to read the China study. Okay, that's it. Veronica said, thank you, Szenan, for sharing with us all important knowledge and experience. Thank you very much. Eric, thank you. Happy day. Thank you for sharing your knowledge with us. Thank you. That's it for today. So remember that it's important. Stay awesome, and I love you all. I'll see you tomorrow.